I think the main achievement is to be able to offer healthcare at the point of need for no cost. I think that's the biggest thing, because yes, you can get excellent healthcare in other parts of the world, but it costs a fortune, and if you haven't got the funds, then you're stumped really. So to be able to offer healthcare and also to have it regulated so that it's equitable across the country, so that everybody has the same access to the healthcare.
Well, I'm really proud to be part of the NHS. I think it's wonderful. I think, you know, if you ask a lot of people, it is still one of the great things about Britain that we have an NHS. I hope that we can continue. Obviously, we need to look at working in different ways because we're covering a lot more people and a lot of different conditions, but I hope that it will still be going for another 60 years.
Well, I think it's improved public health generally. I think we provide a fantastic, wonderful, world-beating service that's free at the point of care. The whole country's paid into. I think we've got excellent hospitals, excellent primary care services as well. I think we've helped to build the nation.
I think it's something we take for granted now, isn't it? Certainly, you know, our generation does. We take it for granted, but I know you hear a few complaints, but what you don't hear is the good work that goes on, and this event has highlighted the good work that is going on. So there's plenty of it going on.
Well, I mean, it's been obviously evolving throughout those 60 years, and we've seen lots of change, I think, especially for me anyway, because I've only been in the NHS for 4 years in the last couple of years. But I like the fact that we are moving forward towards a patient-focused and obviously encouraging our patients to tell us what they need, so it only has to be beneficial for us all.
I think the main achievements are what they set out to do, which was health-free at point of contact, and I think that's the big thing that, you know, perhaps we tend to take for granted, but compared to lots of other countries, obviously it's a very sort of beneficial thing.
I think obviously being able to go to the doctor, have operations without having to worry about how you're going to afford it.
With the ongoing research and new treatments and therapies, there's a finite pot of money, and learning how to utilise that to the best advantages. Services that have been existing may well have to change.
I'm sure there will be as much change, and change is always difficult. We just need to make sure that it's positive both for staff and for the patients who we're serving.
Yeah, I think there's a lot of changes in the pipeline. I think we'll see perhaps more private money coming in, better use of facilities, a lot of modernisation. But you know, as a clinician, we'll see better diagnostic tools, and we'll be able to direct care better for our patients.
I think we need to listen to clients more, and I think clients, obviously, they're much more aware of their rights, they're much more aware of the treatment they want, but I think it's a lot more about empowering people to get more knowledge about themselves and about what their health needs are, really. So I think that's what we need to do. It's more around supporting patients and clients, really, to identify their own health needs, if you like, and to change their lifestyles, hopefully, sometimes.
The change started around 2000. It's a huge change now, and we still have a long way to go, I think. Yes.